Chapter 10 Nutrition. Question number 1. The nurse is teaching about nutritional requirements of the newborn to his new parents. The nurse should recognize that the parents need further instruction when which statement is made. Option A. I will only feed my baby as much formula as he wants to eat at each feeding. Option B. I will mix rice cereal in my baby's bottle before he goes to bed so he will sleep better. Option C. I will hold my baby while I feed him and for about 15 minutes after he eats. Option D. I will wash my hands before I mix my baby's formula. And the correct answer is option B. Solid foods including rice cereal should not be introduced until the baby is at least 6 months old. That's why option B is correct. Question number 2. The nurse is teaching a group of toddler parents about snacks foods that are safe for his age group and should include which food in this teaching. Option A. Grapes. Option B. Popcorn. Option C. Corn chips. Option D. Applesauce. And the correct answer is option D. Applesauce. Applesauce is safe because it is easily swallowed and is not choking hazard. Question number 3. The nurse is working with a group of parents of toddler and should know that further instructions is needed when which statement is heard. Option A. I carefully cut up all of my child's food so he can easily eat it. Option B. I put food on my toddler's plate but I don't get upset if he don't eat it all. Option C. I promise my toddler that he can have a cookie if he does what I ask him to do. Option D. I allow my child to help me cook even though it gets pretty messy. And the correct answer is option C. The food should never be used as a bribe. Question number 4. The nurse knows that which setting would be most effective in assisting teenagers to eat a more nutritious diet. Option A. In a small group of their peers. Option B. At the hospital cafeteria. Option C. At a table with parents. And option D. Served to each teenager privately. And the correct answer is option A. In a small group of their peers, because teenagers are influenced the most by their own peer group. Question number 5. The nurse is performing a nutritional assessment of an older adult client who has reported a 10-pound weight loss in the last 6 weeks with no history of dieting. If no disease process is found, the nurse is aware that weight loss can result from what issue for this age group. Option A. The child attend a daily meal program for senior citizens. Option B. The client appeared to have loose, ill-fitting dentures. Option C. The client lives with a daughter who fixes dinners every night. Option D. The client has a regular elimination schedule. And the correct answer is option B. The client appears to have loose, ill-fitting dentures, because loose or ill-fitting dentures may cause the clients to avoid chewing foods, which can lead to decreased intake and weight loss. Question number 6. The nurse is caring for a client who is in the midst of a 24-hour urine collection for urinary nitrogen and would know which test will help determine if the client has an adequate intake of what nutrient. Option A. Carbohydrate. Option B. Fats. Option C. Proteins. And option D. Sugar. And the correct answer is option C. Proteins. Because the 24-hour urinary nitrogen test is done to measure inadequate protein intake. Question number 7. The nurse is completing an anthropometric measurement of an individual and should use which instrument to complete this assessment? Option A. Yardstick and scale. Option B. Yardstick and tape measure. Option C. Tape measures and ruler. And option D. Tape measures and skin fold clipper. And the correct answer is option D. Tape measure and skin fold clipper, because anthropometric measurements require a tape measure to measure circumference of the upper arm and a skin fold caliper to measure skin fold thickness of the triceps muscle. Question number 8. The nurse is completing an admission assessment of a bedridden client and will use which technique to measure the height of the client? Option A. Place the client in a bed sling and use a tape measure to measure the client's length. Option B. Ask the client to fully extend both arms out to the side of the body and measures the arm span. Option C. Assist the client to a sitting position and measure the length of the client's spine and double the number. Option D. Using a tape measure, measure around the client's fist and multiply by 5. And the correct answer is option B. Ask the client to fully extend both arms out to the side of the body and measure the arm span. Because the best way to estimate height in a bedridden client is to measure the client's arm span. Question number 9. The nurse is working with a group of parents who have children that are extremely picky eaters and tells them that which makes the biggest impact on a child's lifetime eating habits. Option A. Peer groups as teenagers. Option B. Being breastfed as an infant. Option C. Habits learned as a young child. Option D. Lesson on nutrition taught in middle school. And the correct answer is option C. Habits learned as a young child. Because the biggest impact on a child's lifetime eating habits are the habits learned as a young child. Question number 10. The nurse is assisting a client with swallowing difficulties to eat and should encourage the clients to put how much food on the spoon at one time. Option A. 1/4 teaspoon. Option B. 1 teaspoon. Option C. 1 tablespoon. And option D. 3 tablespoons. And the correct answer is option B. 1 teaspoon. Because the client should be instructed to take half to 1 teaspoon with each bite to avoid choking, but be large enough for chewing. Question number 11. The nurse observed a client with dysphagia who is eating and should discourage which activity? Option A. Using a straw. Option B. Using a spoon to eat a milkshake. Option C. Using a towel under the plate. Option D. Sitting at a 90-degree angle in bed. And the correct answer is option A. Using a straw. Because the use of a straw increases the risk of aspiration and should be discouraged. Question number 12. The nurse is feeding a client with dementia and should assist swallowing with which nursing action? Option A. Encourage the client to drink water between each bite. Option B. Stroke the client in a downward motion under the chin. Option C. Blow softly in the client's face to encourage swallowing. Option D. Tell the clients to quickly take bites to facilitate swallowing. And the correct answer is option B. Stroke the client in a downward motion under the chin. Because gently stroking the clients under the chin in a downward motion during swallowing helps to cue the client to swallow. Question number 13. The nurse has just finished inserting a nasogastric tube into a client that will be used for internal feeding and knows that prior to starting the feedings, tube placement will best be confirmed using which method? Option A. Determining the presence of carbon dioxide. Option B. Ensuring that the gastric aspirate has a pH higher than 7. Option C. Obtaining an X-ray to confirm placement. Option D. Inserting 30 ml of air into the tube and listening over the stomach for the whoosh. And the correct answer is option C. Obtaining an X-ray to confirm placement. Because an X-ray is the best way to confirm tube placement because all nasogastric tubes are marked to be seen on X-ray. Question number 14. The nurse is caring for a client who will be receiving continuous internal feeding through a nasogastric feeding tube. The nurse is aware that which is the most dangerous complication associated with improper nasogastric tube placement. Option A. Diarrhea. Option B. Vomiting. Option C. Pneumonia. Option D. Dehydration. And the correct answer is option C. Pneumonia. Because aspiration pneumonia is by far the most dangerous complication associated with feeding a client when the feeding tube is improperly placed. Question number 15. The nurse has just completed insertion of a nasogastric tube that is needed for gastric lavage of a client. Radiographic confirmation of placement is not possible at this time, so the nurse should use which method to best determine tube placement? Option A. Aspirate gastric content and determine the bilirubin level. Option B. Observe for signs of respiratory distress. Option C. Determine that the pH of the gastric aspirate is below 4. Option D. Detect for carbon dioxide and determine the gastric pH. And the correct answer is option D. If an X-ray confirm is not available, the nurse should use two different methods such as lack of respiratory distress and acid gastric aspirate. Question number 16. The nurse is preparing to insert a nasogastric tube in a newborn and plans to use which landmark to ensure that the tube reaches into the infant's stomach? Option A. The tip of the xiphoid process. Option B. Midway between the nipples. Option C. Midway between the xiphoid and the umbilicus. And option D, the top of the symphysis pubis. And the correct answer is option C, midway between the xiphoid and the umbilicus. Because in a newborn, the length of the NG tube is measured from the nose to the tip of the earlobe to a point midway between the umbilicus and the xiphoid process. Question number 17. The nurse is caring for a client receiving internal nutrition through a syringe. Midway through the feeding, the client complains of gas pain. Which is the nurse's best action at this time? Option A, contact the healthcare provider. Option B, clamps the tubing going to the clients for a short time to see if symptoms are relieved. Option C, stop the feeding and remove the nasogastric tube. Option D, continue the feeding while reassuring the clients that this is a common issue related to internal feedings. And the correct answer is option B, clamp the tubing going to the clients for a short time to see if symptoms are relieved. Because if a client complains of flatulence, cramps, or vomiting during a syringe feeding, the nurse should pinch or clamp the tubing to stop the flow for a minute. Question number 18. The nurse has just begun a new internal feeding on a client using a closed system of formula. The nurse labels the bag with the time and date it was begun, 1300 hours on 12/6, knowing that this will mean the feeding tubing set will need to be changed at which time and date. Option A, 1300 hours on December 7. Option B, 1 a.m. hours on December 7. Option C, 1300 hours on December 8. Option D, 1300 hours on December 9. 1300 hours means 1 p.m. 0100 means 1 a.m. And the correct answer is option A, 1300 hours on 12/7, that means 1 p.m. on December 7. Because whether using a closed or an open system, the feeding tubing set is usually changed every 24 hours to reduce the risk of contamination. Question number 19. The nurse is caring for a client receiving total parenteral nutrition and will instruct the unlicensed assistive personnel UAP to complete which assessment every 4 hours? Option A, blood pressure. Option B, pulse. Option C, temperature. And option D, pain level. And the correct answer is option C, temperature, because the client receiving TPN is at a high risk for infection, so temperature assessment should be completed at least every 4 hours. TPN means total parenteral nutrition. Question number 20. The nurse started a lipid infusion on a client approximately 1 hour ago and will observe for which sign and symptoms related to lipid side effects. Select all that apply. Option A, dizziness. Option B, peripheral neuropathy. Option C, nausea. Option D, joint pain. Option E, headache. And option F, insomnia. And the correct answer is option A, C, and E. A, dizziness. C, nausea. And E, headache. Because dizziness is an IV lipid side effects, nausea and vomiting are non-IV lipid side effects, headache is a non-IV lipid side effect. And question number 21 is, the nurse is preparing to infuse intravenous lipids on a client and should utilize which safety considerations when completing this action? Select all that apply. Option A, perform hand hygiene prior to touching any of the equipment. Option B, swab the stopper of the IV bottle with alcohol and immediately spike the bottle. Option C, hang the IV bottle of lipids approximately 18 inches above the IV site. Piggyback the lipid into the port closest to the client. Option E, set the pump for 100 ml per hour. And the correct answer is option A and option D. Option A is perform hand hygiene prior to touching any of the equipment. Option A is perform hand hygiene prior to touching any of the equipment, and option D is piggyback the lipids into the port closest to the client, because hand hygiene should always be performed prior to beginning any procedure. In addition, the nurse will wear clean gloves when hanging the infusion. The lipids should be piggybacked into the port closest to the client. Thank you.